My name is Irene Day. I'm the Director of Operations at the British Columbia Centre for Excellence in HIV and AIDS. I will MC this event. Thank you all for joining us. Here today, our panel, HIV Foundation Queensland, here today joining us at our panel, plus the HIV Foundation Queensland board members and CEO, Queensland Chief Health Officer, Dr. Jeanette Young, and other Department of Health representatives, Queensland HIV STI Professorial Chair, Professor Charles Gilks, University of Queensland, Queensland Positive People, Community HIV Education and Prevention Program officers, our Canadian colleagues, and of course the media. We are delighted to be here in Melbourne in beautiful Australia. And thank you to the IAS Media Centre for their assistance in setting up this press conference. As well, I want to mention my Queensland colleagues, Tony Major and Melissa Warren from HIV Foundation Queensland. You both have been a delight to work with, and I thank you. We have 5 speakers. Each speaker will speak for 3 minutes or less. The first speaker will be the Queensland Minister of Health, the Honourable Lawrence Springborg, followed by the Canadian Deputy High Commissioner to Australia, Charles Reeves. By video, the British Columbia Minister of Health, Dr. Terry Lake, followed by the Chair of the HIV Foundation Queensland, Dr. Darren Russell, and last, however, not least, our esteemed Director of the BC Centre for Excellence in HIV and AIDS, Dr. Julio Montanez. We may have an additional guest.
We do. He's here.
Oh, I'm sorry, I missed you, Luis.
Yeah,
Dr.
right.
Luis Lourdes. After the speaking presentations, Minister Springborg, Dr. Russell, and Montana will sign the MOU. You're welcome to do photos during the MOU signing. Following the signing of photos, I'll open the floor to media questions, and there will be an opportunity for individual interviews at the conclusion of the press conference. Let's begin. Minister of Health, Honourable Lawrence Springborg, the floor is yours.
Thank you very much, Irene, and can I just say that we're absolutely delighted to be here today, ladies and gentlemen, and certainly I'm delighted on behalf of the Queensland Government to be able to sign what is a fantastic partnership arrangement, indeed the first one in our nation. And can I thank the British Columbia Centre for Excellence for their support and for them facilitating this as well. And I've also been able to see the video presentation from the Provincial Minister Lake as well. It's great to be here, of course, with such an august panel on such a significant day. In Queensland, we have been very keen to make sure that we use an evidence-based approach to deal with what is still a significant problem of HIV in our community. And of course, evidence means that you should take on board the latest learnings and implement what is excellence with regards to not only the diagnosis but also the treatment and prevention of HIV. When I became Minister, I established a Ministerial Advisory Committee on HIV, which has recently become the HIV Foundation in our state. We are proud of the work which they have done because they have been leading in the work of rapid testing, not only in our state but right across the country. We've also been partnering with Queensland Positive People to make sure that we have what is peer-supported rapid testing in the community, and we'll also be embarking upon home testing options for people as well. So it makes a lot of sense that if evidence is showing us successful cases around the world where treatment as prevention has not only been implemented but is showing great success, then we should take the chance to also lead the nation as well. So we are delighted to be a part of signing this MOU with the British Columbia Centre for Excellence, of course, to be co-signed by Darren Russell as well, the chair of our foundation. And also can I acknowledge the Deputy High Commissioner Charles Reeves and say thank you very much for representing your country here today, and also Dr. Montana, who was able to brief us earlier on. So we look forward to making sure that our commitment, which has so clearly been enunciated across our nation in our legacy legacy statement bears real fruit as well, and that we are prepared to work and to share and show evidence of the success of treatment as prevention. We do believe that this will significantly help us be able to really work towards the virtual elimination of new AIDS diagnosis, or HIV diagnosis, I should say, in Australia by 2020. So we're absolutely delighted to be a part of this partnership, and thank you very much to the British Columbia Centre for Excellence for their facilitation and their great willingness to be such a very supportive partner. And we look forward as well, not only to learn from them, but also to share our learnings, because whilst in many ways human beings are very similar, the circumstances, whether they be geographic or otherwise, are often different and require us to be able to sometimes implement and do things differently. So hopefully some of our learnings will be of use as well.
Sure. Thanks very much, Minister. Our second speaker is the Canadian Deputy High Commissioner to Australia, Charles Reeve.
Thank you, Irene. Good morning, Minister Springborg, Drs. Montana, Russell, Lorez. I'm a bit humbled to be amongst such a prominent panel this morning, but I'll offer my few remarks. I'm very happy to be here at the 20th International AIDS Conference and to participate in this exciting partnership being announced today with the jurisdiction of Queensland, the HIV Foundation Queensland, and the British Columbia Centre for Excellence in HIV/AIDS. Treatment as prevention is a strategy pioneered by Dr. Julio Montanez in British Columbia, Canada. Thanks to this Made in Canada model, BC has moved significantly closer to an AIDS and HIV-free generation. Queensland will be a model to emulate for other Australian jurisdictions and indeed the rest of the world. We are pleased treatment as prevention has been enthusiastically endorsed by UNAIDS and now serves as the basis for the new proposed global AIDS control strategy. As well, the new WHO guidelines recently released represent a huge step globally in optimizing the impact of highly active antiretroviral therapy. Queensland, your commitment to implementing treatment as prevention moves you into the ranks with China, Brazil, France, Spain, Sierra Leone, Panama, and parts of the United States. In just a few years in British Columbia, under the leadership of Dr. Montana, the pioneered treatment as prevention strategy has decreased morbidity and mortality by greater than 90% and decreased new cases of HIV by greater than 66%. Mother-to-child HIV transmissions have been virtually eliminated in British Columbia. Not only does this strategy have cost-averting implications to healthcare dollars, if maintained, it promotes the sustainability of the healthcare system. Treatment as prevention is a really good news story, provincially, nationally, and internationally. At this conference, we've heard a lot about the collaborative efforts to end HIV and AIDS. Through this partnership, Queensland and British Columbia are extending that global cooperation. This MOU will mean the transfer of knowledge and sharing of research, moving us all collectively ever closer to the elimination of HIV and AIDS. Thank you.
Thank you, Deputy. And I just needed to make a comment about the Deputy because we are actually blue nosers. The Deputy is from Annapolis Valley, and I'm from Nova Scotia as well, so it was good to come up and meet a colleague. Unfortunately, our British Columbia Minister of Health, Dr. Terry Lake, was not able to join us. However, he has provided a video presentation. Just before we play that video, Dr. Montana will read a short note from the Minister.
Thank you, Irene. As you can imagine, the video was put together in anticipation of this press conference. However, the Minister felt that in view of recent events, he wanted to add a few additional words to what you will hear in a moment. The following is a personal message from Honourable Terry Lake, Minister of Health of British Columbia. On behalf of Premier Clark and the citizens of British Columbia, I extend my condolences to the families and friends of those lost on flight MH17. These include scientists, physicians, community representatives, and researchers who were en route to the International AIDS Conference in Melbourne. Among those was Dr. Joep Lange, a renowned HIV clinical scientist who was a friend, mentor, and colleague to many of you in Melbourne today. Dr. Lange's groundbreaking work has saved countless lives and had significantly impact in changing the face of HIV treatment worldwide. And as Canadians, we join countries around the world in mourning the loss of one of our own on this flight 24-year-old medical student, Andre Angel of Ajax, Ontario. Today, as we mark another milestone in our fight against HIV and AIDS with the signing of this memorandum of understanding, we reflect on the pioneering work of Dr. Lange and his colleagues and recognize the significant impact their laws will have not only on their loved ones, but on the HIV/AIDS community as a whole. The thoughts of all British Columbia are with their families and friends. Sincerely, Terry Lake, Minister of Health.
Thank you, Dr. Montana. May we have the video, please?
I'm Terry Lake, Minister of Health for the province of British Columbia. In British Columbia, we're very proud of our achievements in the global fight against HIV/AIDS using the treatment as prevention strategy. With the help of Dr. Montana and the BC Centre for Excellence, this approach has helped reduce HIV deaths by over 90%, and it's virtually eliminated mother-to-child transmission of HIV. We're really thrilled to see China, France, Brazil, Panama, and now the state of Queensland adopt this prevention strategy and become leaders around the world. We believe with increased awareness and engagement in prevention and care, we can move toward our goal of eliminating new cases of HIV and achieving an AIDS-free generation. We're really proud of the work our team in BC is doing, and we invite scientists, healthcare providers, and policymakers from Australia to Vancouver in 2015 for the International AIDS Society Treatment and Prevention Conference. Congratulations on the signing of this Memorandum of Understanding, and on behalf of the province of British Columbia, thank you for your efforts to combat this very preventable disease. Thank you.
Thank you. We at the BC Centre for Excellence in HIV and AIDS are very pleased to have the tremendous support of our Premier Christy Clark, the BC Minister of Health, Terry Lake, who you just heard from, and all the BC government. Our fourth speaker this morning is the Chair of the HIV Foundation Queensland, Dr. Darren Russell. Darren.
Thanks, Irene. Deputy High Commissioner, Minister Springborg, Drs. Lourez, Montana, ladies and gentlemen, welcome here this morning. I'm the chair of the HIV Foundation Queensland, which came into being on the 1st of December last year. Our task is quite simple, really. It is to reduce the impact of HIV in the state of Queensland and ultimately to end transmissions of HIV. We aim to do that by 2020, in line with other countries around the world now. In order to get there, we have to do more than what we've done before. Condom promotion, of course, is vital and will remain a vital part of the strategy, but it's not enough. And we've known this for several years now, that despite condom promotion and other work in that field, rates of HIV have not been dropping. So more has been needed. With that in mind, we've embarked on a fairly adventurous goal of ramping up testing and ramping up treatment. It sounds fairly simple, test and treat, but in fact there's a lot of complexity with it. We have to bring the community along with us. We have to bring the doctors, the scientists, the researchers along with us. And I know Dr. Montana has had a few battles along the way to try and achieve those ends. So we're very proud to be able to partner with the British Columbia Centre for Excellence in furthering these aims. President Clinton yesterday alluded to the new UNAIDS goals of 90-90-90. 90% of people with HIV diagnosed, 90% of people on treatment, and 90% of people undetectable viral load on treatment. We will, of course, be taking up the cudgel here and trying to get to that level. We've got a little way to go in Queensland, but we're optimistic that with the support of the British Columbia Centre for Excellence and our partnerships with community, doctors, government, that we'll be able to achieve that aim. So we're very proud to be part of this partnership, and we wholeheartedly thank the British Columbia Centre for Excellence and the British Columbian provincial government for their support. Thank you.
Thank you, Dr. Russell. Our next speaker is from UNAIDS, Dr. Luis Lourdes. Luis.
Thanks, Eileen. This conference, Melbourne, I think we will be with us for a long time. We are watching a major shift in terms of the response to AIDS. Melbourne is already in the history of AIDS. In a way that Melbourne will jump us to the journey to end this epidemic, more than ever. I'd like to highlight at least three aspects in terms of what we have ahead and where we are keep the hope. First of all is on science. And you heard about what we know today about treatment as prevention, about the impact, about the 999 as was referred to. Science is on our side. There was a time that was not like that. In the beginning of the epidemic, when there was no hope, the pre-science phase was show to us what this epidemic is about. But in response to social mobilization, science catch up, and now give us more hope than ever. Another fundamental factor in the way forward is global solidarity. Mainly when we start to face more and more epidemic that is being determined by stigma and discrimination, and less by the HIV virus, we know how to beat, global solidarity becomes essential. Not only in terms of bringing together and to share experiences that work, but as well to make us stronger to face the challenges that we have between now and the end of the epidemic. I think it's in that context that the UNAIDS acknowledge and we are part of and we will be with you on this cooperation between British Columbia and Queensland. That's not only, I think you have impact here in Australia, you have impact in Canada, but you are set an example for the world in how to go. We cannot miss anymore. We cannot waste time. We cannot waste resources. We need to come together and be more effective to response. And my last point is about people. If you see the AIDS history during the last 3 decades, there are many ways to see. You can see through events, you can see through progress on science, you can see through social mobilization, through activism, but has been a lot about people and leadership. And if we are seeing here the leadership of Queensland to take this forward on the context that I outlined before, I'd like to highlight here the leadership by Julio Montanez, the Minister of Health, that's my friend in BC, by all the other representatives here. It did not happen if we do not have a person like Julio that in the very beginning he thought that he had something in hands and went for. And I can tell you the journey was a very bumpy one. There was a lot of challenges, but where we are today, we are probably having now one of the major instruments that, as I said before, you will bring us to the end. You take some time, it's a long journey, but more than ever. I think Australia, we are living Australia with more hope than ever. Thanks.
Thank you, Luis. Our final speaker is Dr. Julio Montanez, Director of the BC Center for Excellence in HIV and AIDS. Julio.
Thank you, Irene. Honourable Minister, my good friend and boss, Dr. Luis Lourdes, my fellow representative, Charles Reeves, and my new friend and collaborator, Dr. Darren Russell. It is indeed a pleasure and an honor to be here today. Before I say anything further, I want to acknowledge the presence of HIV representatives, both from the community at large and from our First Nations representatives. Ken is here on behalf of the First Nations communities in Canada. We appreciate your support and your continued encouragement. As Luis said, many years ago, we came to the realization that treatment is not only the best tool that we have to prevent disease progression and premature death, but also is virtually 100% effective at preventing HIV transmission when an individual is adequately and appropriately treated. This recognition became sort of as a byproduct of us doing the right thing, which was to make treatment available to all people in need in the province of British Columbia. However, at times it's difficult to take these kind of observations to the next stage, and it took us about a decade to finally get enough evidence to convince ourselves that we could make a statement and a call for the expansion of antiretroviral therapy use and coverage to stop this epidemic. That was 10 years ago. And I must say that although I'm a very impatient person and I like to see things moving rather quickly, when I reflect on how long it has taken for other scientific breakthroughs to make it to the practice, I should be reasonably pleased that we're moving at a steady pace and the momentum is building significantly behind ourselves. None of these would have been possible without the tremendous support of the government of British Columbia, which very early on saw the importance of making this a priority. And for that, we're thankful. At the global level, none of that would have been possible without the leadership of UNAIDS. Michel Sidibe and Luis Loures, here present, have been unwavering on their support for this cause. And in fact, at this conference, they have actually gone yet one step further by calling for new global targets, ambitious targets, of 90% of people infected with HIV being diagnosed, 90% of those be placed on antiretroviral therapy, free and on a sustained basis, so that 90% of those can achieve virological suppression, so we can prevent AIDS, death, and HIV transmission, so that we can finally begin writing the last chapter of this epidemic. If we achieve the 90-90-90 targets by 2020, I have no doubt that by 2030, we will be celebrating the transformation of what once was a raging pandemic into an endemic sporadic disease that even my younger medical colleagues may not even recognize. This is something to be celebrated. On that note, I am delighted to have the opportunity to collaborate with our colleagues here locally as an opportunity to open this initiative to yet a new continent, a new country, a new continent, and a new region. This is important for us, for our own programs, but as I was telling the minister earlier on, this should be an example for the rest of Australia and for the rest of the region, and ultimately for the rest of the world. I am extremely encouraged by this arrangement. The MOU represents a significant step forward in our fight, and I would like to thank you all for putting your faith on this strategy, which I have no doubts will contribute to better health and a cost-averting strategy at the end of the day for your people. Thank you.
Thank you very much, Julio. We'll now have the signing of the MOU. Tony? Pass that along to Dr. Russell and Dr. Montana. Thank you very much, gentlemen. And now we'll open the floor to any questions. There are mics on either side of the room, so if you make your way to the mic. And if you would just introduce yourself and your organization.
Sure. I'm David Alexander from the Star Observer newspaper. I'd just like to ask initially Julio his opinion of peer-led. Minister Springborg referred to peer-supported community groups, working with peer-supported community programs and initiatives. What do you think is the importance of peer-led community programs and campaigns?
The only way that we can make these treatments available successfully, and these strategies available and successful as part of a combination prevention program, is if the community is on board with it. And while we can have all of the science behind us and all of the knowledge that you are aware that we have accumulated over all these years, the only way to translate that into a language that can be fully comprehend and understand by those that we're trying to help and assist, to give them the confidence that this is the best thing for them, is to learn from their peers who had traveled that road before, that ultimately this has been good for them. And so we, wherever possible, promote, support, and encourage peer involvement from peer-led groups, but also more and more bringing peers into the medical environment as peer navigators, as counselors, etc., so that they can truly translate what we're talking about into terms and language that can be relevant to the people that we're trying to help. And this is complex because we're dealing with multiple communities that need to be engaged. And so more and more we understand that there need to be social and culturally adjusted programs led by peers that can address the needs of the multiple groups that we're most interested to engage with.
Does the Minister support those comments?
Absolutely. I think that it's very important as a part of any strategy, and particularly when you're dealing with HIV, is to raise the awareness in the community that we still have a significant challenge. And I think that when we embarked upon this journey last year to raise awareness in our state, that there was a lot of surprise amongst people who thought that the issue had been largely dealt with in the 1980s, and there had been many people working in the field who had been trying to raise that particular awareness over that time. So awareness, targeted strategies with regards to communities that may be affected, also making sure that we have evidence-based approach, whether it be around diagnosis and treatment, all extremely important. But as Dr. Montana said, the effective translation of what we know into the benefits of the community generally must happen by the support of peers in the community in the various communities that may be principally affected by it. So not one particular approach will work with regards to this, but having that peer support and awareness in the community is vitally important, I believe, to making sure that we can go to the next stage of success in our state at least, and probably given the learnings from around the world elsewhere as well.
If you forgive me, I have a few more questions. Given the legacy statement that Minister Springborg has signed up to, that was announced during the week, and then Peter Dutton, the National Health Minister's national strategy on HIV and AIDS, both heavily supporting peer-led, these peer-led community groups. Does the Minister, in light of recent events in Queensland, believe that he can fulfil the points made out in the national strategy and the legacy statement given past?
Well, yes, I do, and we've had to make some changes to our strategy in Queensland for a number of reasons. One was that we had a significant increase in new diagnoses in our state, and a lack of broad community awareness, and I think appropriately targeted strategies around that. And under the HIV Foundation, which was previously the Ministerial Advisory Council, it's taken a whole new level of autonomy. We've been able to bring on board a whole range of people who have been interested in HIV awareness and prevention, those people that have been in the communities that are most likely to be affected, and health professionals and those clinicians that have been working not only to raise awareness but to effectively treat the condition in our community and to also fight against increasing incidence of HIV in our community. And as Dr. Russell said a little moment ago, what we can't do is necessarily keep doing things the way that we were going before, because it wasn't necessarily giving us the results and the outcomes which I think all people yearn for, and that is a greater awareness, a greater diagnosis of this issue in our community for those that are living with HIV and are positive, and also then starting an appropriate treatment regime to then reduce the incidence into the future. So I do believe that we can. I'm very encouraged by some of the recent results we're actually getting in the state of Queensland, and the mere fact that we are prepared to take on board and suggestions, ideas and learnings from elsewhere where others are still very, very reluctant to tread, I think is an indication that we are prepared to be very, very open, not only about new strategies, but how those strategies are implemented in the community.
If you excuse me, given your support that you've just mentioned of peer-led community groups and campaigns, can you confirm